Hello, I'm Dr. Anil Goday and I'm a consultant in reproductive medicine, surgery and assisted conception at the Homerton Fertility Center. A very important question. How long can you continue clomiphene? And see, what is the evidence here now? We say 6 cycles of clomiphene continuously is the maximum you can give, and that no more than 12 cycles in a lifetime. So we'll look at that evidence too. And the question asked is, can we give clomiphene longer than 6 months? So what is clomiphene? It's a non-steroidal compound that resembles estrogen and blocks the hypothalamic estrogen receptors. And it signals a lack of circulating estrogen to the hypothalamus. And the hypothalamus is a fascinating organ. And what it does is it changes the pattern of pulsatility of the release of GnRH, resulting in discharge of pituitary from a gland. And so the entire the way that the pulses of nature of GnRH changes, and that is why it tends to work differently. It results in about a 70 to 80% ovulation rate and a 40 to 70% conception rate after 6 cycles. So in this study, women 18 to 40 and had 6 cycles of type 2 amenorrhea of ovulatory disorder, and that 6 cycles of clomiphene with a maximum of 150, and all these patients had ovulated and they did not fall pregnant. So at a maximum of 150, ovulation having occurred and no pregnancy. And the treatment was carried out for 12 cycles of clomiphene, and they needed to have ovulated in all those 12 cycles of clomiphene. And then we looked at the results. So if we started looking at the results of 114 women, you saw right from the 7th, 8th, 9th, 10th, and 11th and 12th, there seems to be a steady increase of a pregnancy rate. And in fact, between cycles 7 and 12, there's a 54% pregnancy rate of ongoing pregnancy rate that tends to occur. And that's quite a reasonably good pregnancy rate. So at present, there have been no randomized controlled trials of women who ovulate on clomiphene and did not conceive within 6 months and what treatment worked. 2 small cohort studies were done which looked at clomiphene between 10 and 12 cycles, and pregnancy rates range from 80 to 67%, but they were quite old data. And what this study tries to tell you is that if you used clomiphene for more than 6 cycles, up to the maximum of 12 cycles, you may give an ongoing pregnancy rate of about 54%. And that's quite stunning. And in fact, I don't think there has been any such study done which looks at extended use of clomiphene in improving chances of pregnancy. The next question comes up is, what is the evidence of cancer? And that's the scary part. And we have traditionally gone and told everyone that don't take clomiphene for more than 6 months at a stretch, because there is that risk of cancer. And let's look at the evidence. And remember, this was never published and it was presented. And in fact, it has been discredited, I believe, at times, and we're not entirely sure of that. But 3,837 infertile women, and 11 of those women were identified as borderline or invasive malignant ovarian tumor. Okay, 11 so look at the percentage. And then 9 of these used clomiphene, and 5 had taken clomiphene with more than 12 cycles out of 3,837 women. And that's it. And that's what told us that, well, if you use clomiphene much longer, then there could be a chance of cancer. But the data is extremely poor, and literally I don't think can be held up at all. If you look at histological studies, and this was again done in 2009, and what they looked at cystectomies and oophorectomies of patients who had IVF, and they derived that there's a possible dysplasia, ovarian dysplasia, which is associated with ovarian hyperstimulation. Again, 2 of the 35 women who were treated for clomiphene more than 6 cycles. So based on literally 7 cases of clomiphene, that the entire advice of not more than 6 cycles has been given, I don't think we really know that at present. And frankly speaking, we feel that the fertility drugs are safe, but the long-term use and its impact on cancer in later years is a question mark. And I think it will take a long time to us to try and find out what can happen. So in conclusion, we would say in WHO type 2 anovulation who are ovulatory with clomiphene, I think it is reasonable in some cases where patients cannot afford to give clomiphene much longer, as long as the endometrium is trilaminar and looks decent, more than 7 millimeter, and they are ovulatory. Whether or not gonadotrophins and IUI, or whether letrozole would give a better chance of pregnancy, is something which is undergoing a lot of study and debate, and slowly we think letrozole is managing to edge clomiphene out of as a first line of therapy. So in fact, I think this paper is probably one of a much better paper to look at in terms of addressing our question, how long can you continue clomiphene? If you like this lecture, please share it and try